Welcome back, everyone. Today we'll be going through PFT testing, which stands for Pulmonary Function Testing. The tool that we use for pulmonary function testing is the Astra 300. In order to get started, we have to input all of the subject information. Great. In order to start, we need to press the blue on button. For the tests that we'll be doing, we're going to choose the FVC option, which means forced vital capacity. Here it'll allow us to enter all of the patient information. ID is their date of birth, first and last name. So date of birth, we'll put in 01/01/1992. Their first name is Joe, last name, bronchioles. For the sake of this video, we'll leave it at Joe B. Make sure to change the gender. This will play into the normative values that this machine gives us at the end of the test. Now it'll allow us to enter the age. Joe is 26, 67 inches tall, and 150 pounds. The tech is myself, so I'm gonna leave that at CS. Now we're ready to start the test. In order to start the test, what we would have to do is press this button right here, which looks like a little man doing the FVC test. Great, now that we've input all of Joe's information, we're going to explain the test to him. In order to start, we have to give the subject a nose clip. The nose clip will allow us to isolate the subject's lungs from the ambient air. Here you go. You're gonna place the nose clip on, and you're gonna ask the subject if they can breathe through the nose clip whatsoever. Joe, can you breathe through the nose clip?
A little bit.
All right, shift it around and see if you can. Fantastic. Now that Joe can't breathe through the nose clip, we're going to take this piece right here, this is the mouthpiece, and it's going to go on the arrow side of the PFT. Be sure not to touch the mouthpiece with your hands as best you can. Otherwise, you run the risk of contaminating the mouthpiece. Good. Now that the mouthpiece is in, we can go ahead and give the PFT to Joe. Make sure you press the button. Now Joe, the way this is going to work is you are going to put the mouthpiece on. Fantastic. You can breathe normally through the device. When I say go, you're gonna take a full deep breath in, then you're going to forcefully exhale as quickly and as harshly as you possibly can, and then you're going to take another full deep inhale in when I tell you to. Are you ready? Mm-hmm. All right, go ahead. Very good, keep going, keep going, keep going. Take a full breath in and take the mouthpiece off. Great job. Now that we have all of the data for Joe's test, we can go ahead and interpret it. Once you've completed your test, you'll be shown this results screen. In order to get into the more elaborate results, we need to click the top right corner here. This will give us a few of the components that we're concerned with primarily. The first is FVC. This stands for forced vital capacity, which is the amount of air that you could get out of your lungs. If this is low, we're concerned with restrictive lung disease, which is due to inadequate filling capacity. The next thing that we're concerned with is FEV1, which is forced expiratory capacity in 1 second. So how much air you can get out of your lungs in the first second of that forced exhale. If this is low, we're concerned with obstructive pulmonary disease, which prevents air from leaving the lungs. The next thing that we're going to be concerned with is FEV1 over FVC. This is a ratio of how much air you get out in the first second as compared to how much air you can get out of your lungs. If this is low, we're also concerned with obstructive pulmonary disease. This ratio should result in a percentage of over 70% in healthy individuals. Lastly, we're looking at PEF or PEFR. This is your peak flow rate, and this is reduced from normative values in obstructive conditions as well. Great, now that we've completed the test, there are a couple final points that I want to discuss. The first is the PFT should be calibrated quite frequently, in between every 10 patients or every week, depending on how often it's used. If it's used quite frequently, we want to go in between every 10 patients. It'll be calibrated by this 3-liter syringe. The calibration protocol can be found below. The next thing that we want to discuss is the use of a nose clip. The nose clip will isolate the subjects from the ambient air, which will prevent any air from escaping through the nose and not through the pulmonary function device, the Astra 300. In the event that you do not use a nose clip, your FEV1 and your FVC will both be diminished because air will escape from the nose. On that note, that is it for the PFT function video. I hope you all enjoyed.